So if you're learning how to tap, here are the tapping points. The first one tends to be the side of the hand, and it is when we say our setup statement and the words that we're going to focus on of what change we're attempting to get that session. Now, tapping with 2 fingers, your dominant hand on that fleshy part there, and it can be gentle. It doesn't need to be a hard tapping process, and it tends to be just as long as you're saying those words. So we're not necessarily counting how many times we're tapping. Now, in clinical EFT from the research trials, these are the points we then focus on. Start of the eyebrow, and it can be a gentle tap. We will be saying the reminder phrase during this. The second point is the side of the eye. The next one is under the eye. Again, not counting how many times. Under the nose. We would be focusing on the words that we're trying to say there. On the crease of the chin. The next one is an inch under the collarbone. And then under the arm, about 4 fingers from the armpit. And the last point in clinical EFT is the centre of the head, and I like to use an open palm for that one. So that constitutes a round of tapping. Some people like to do 1 round, check how they feel. Others like to do 2 or 3 rounds, and that's completely up to you as well. So in the next video, we're going to show you how to use EFT tapping to reduce a strong feeling or emotion, something like stress, or even a strong feeling like anger.